Hello and welcome. Today we're diving into a somewhat lesser known but significant condition, chemical cystitis. This isn't your typical bladder infection caused by bacteria. Instead, it's an inflammation of the bladder lining triggered by chemical irritants. Let's explore what causes it, how it affects the body, and what we can do about it. So, what exactly causes chemical cystitis? The key culprits are various chemicals that come into contact with the bladder lining. This can include medications, particularly certain chemotherapy drugs like cyclophosphamide and ifosfamide, which, when broken down in the body, produce irritating metabolites. Other potential irritants are feminine hygiene products containing strong perfumes or dyes, spermicides, douches, and even certain bath products. Rarely, bladder installations, a procedure where medication is directly put into the bladder, can also trigger it. Now, let's talk about how chemical cystitis develops. The bladder is lined with a protective layer called the glycosaminoglycan, or GAG layer. This layer acts as a barrier against irritants in the urine. When chemical irritants repeatedly come into contact with the bladder, they can damage or disrupt this GAG layer. This allows these substances to penetrate the bladder wall, causing inflammation, irritation, and ultimately the symptoms of chemical cystitis. The damaged bladder lining becomes hypersensitive and more reactive to even normal urine components. Unlike bacterial cystitis, which is more prevalent in women due to anatomical reasons, chemical cystitis doesn't have a strong gender predisposition. Its occurrence is more directly tied to exposure to the causative chemicals. So, individuals undergoing chemotherapy with specific drugs or those frequently using irritating feminine hygiene products are at higher risk. The epidemiology is difficult to pinpoint precisely, as many cases may go undiagnosed or misdiagnosed as other forms of cystitis. The signs and symptoms of chemical cystitis can mimic those of a typical bladder infection, but there are often some subtle differences. Common symptoms include a frequent and urgent need to urinate, even when the bladder is relatively empty. You might experience pain or burning during urination, a sensation of pressure or fullness in the lower abdomen, and occasionally blood in the urine known as hematuria. In severe cases, there can be lower back pain or difficulty emptying the bladder completely. Diagnosing chemical cystitis involves a careful evaluation by a healthcare professional. They'll likely start with a thorough medical history to identify potential chemical exposures, such as medications or hygiene products. A urine analysis can help rule out bacterial infections. However, the key diagnostic step is often cystoscopy, a procedure where a small camera is inserted into the bladder to visualize the lining. This allows the doctor to directly observe any inflammation, irritation, or damage. In some cases, a bladder biopsy may be taken for further examination under a microscope. Chemical cystitis isn't typically classified into distinct types in the same way as some other diseases. However, it's more accurate to categorize by the degree of severity. Mild cases might involve slight irritation and manageable symptoms, while severe cases can cause significant bladder damage and chronic pain. The underlying cause also plays a key part in its manifestation. Treatment for chemical cystitis focuses on alleviating symptoms and protecting the bladder lining. The first step is always to remove or avoid the offending chemical irritant. For those undergoing chemotherapy, doctors might adjust the medication dosage or explore alternative therapies. Symptom relief can be achieved with pain relievers, antispasmodics to reduce bladder spasms, and medications to coat and protect the bladder lining, like pentosan polysulfate sodium. Bladder installations with medications like hyaluronic acid or chondroitin sulfate can also help repair the GAG layer. In severe cases, more aggressive treatments, such as surgery to repair bladder damage, might be necessary. Prevention of chemical cystitis revolves around minimizing exposure to chemical irritants. If you're on medications known to cause it, discuss the risks and potential preventative measures with your doctor. Avoid using heavily perfumed or dyed feminine hygiene products, douches, and harsh soaps. Drink plenty of water to dilute your urine and reduce the concentration of irritants. Practicing good hygiene can also help prevent infections that might exacerbate the symptoms. The prognosis for chemical cystitis varies depending on the severity of the condition and the effectiveness of the treatment. In many cases, symptoms can be significantly improved or even resolved with proper management and avoidance of the causative chemicals. However, chronic or severe cases may require ongoing treatment to manage symptoms and prevent further bladder damage. Recent research is focusing on developing more effective bladder protectants and exploring targeted therapies to repair the damaged bladder lining. More research is being done to further understand how the disruption of the GAG layer leads to the inflammation and pain and develop novel ways to preserve it.